Hello, good morning. This is your nurse Edwin again. And this time I would like to discuss on how to easily understand on interpreting ABGs or arterial blood gases. Arterial blood gases or ABGs are among the more complex assessments performed by clinical healthcare professionals. Fortunately, there are some easy ways to remember on how to decipher these important results. So let's first understand what is the normal ABG. So when interpreting ABG results, it is essential that you know what ABG values are considered normal. Because from this baseline, you can then begin to recognize significant variations in a patient's results, which could lead or which could indicate, I would say, clinical deterioration. So the first value that I'm going to discuss is the pH, which measures how many hydrogen ions are in the sample. This particular measurement determines if the blood is either acidotic or alkalotic. Normal values for pH range from 7.35 to 7.45. The next value is the carbon dioxide level, and this will tell you if the problem is respiratory in origin. As carbon dioxide, as we all know that, is regulated by the lungs. So the normal range for carbon dioxide, we in ABG result, it is the PaCO2. Again, the normal range for PaCO2 is 35 to 45 millimeter mercury. And the next value finally is the bicarbonate ions or HCO3 bicarbonate. And this will tell you if the problem is related to metabolic changes in your patient and to the renal system. So the normal is considered to be from 22 to 26 millimole per liter. Let's put it simply. So when the numbers in the ABG result fall outside of these ranges, you can then determine what type of problem the patient is experiencing. So let's try to understand whether the patient is experiencing either acidotic or alkalotic. So if the ABG or the arterial blood gases result reveal pH numbers are not within the normal range, then the pH level or the patient's pH level would either be acidotic or alkalotic. So the lower the number, the more acidotic the patient is. For instance, a pH, for example, of 3, that is severely acidotic, and that requires emergency intervention. Alkalosis, on the other hand, is the opposite. So the higher the pH, the more base is in the blood, which eventually can disrupt the normal functioning of the body. Okay? Now, so once you've determined whether there is too much acid or too much base, you can now move on to determine the cause of it. So how do you do that? So determine whether the cause is being a respiratory in origin or metabolic in origin. So now look at the bicarbonate, for example. Is it respiratory or metabolic? So it is, of course, metabolic. So once you've determined whether the sample is acidic or alkaline, you need to work out if it is due to respiratory or metabolic causes. Again, you are trying to determine whether what really causing the problem, either acidotic or what is either respiratory or metabolic, I mean. So if the cause is respiratory in nature, so you will look at the PaCO2 will be out of the normal range. Whereas if for metabolic problems, the bicarb will be the abnormal. So low PaCO2 points to respiratory alkalosis. Again, low low PCO2 points to respiratory alkalosis, and the high bicarb can indicate metabolic alkalosis. Now, let's try to understand whether it is a compensated or uncompensated. Compensation, guys, can be thought of as the body's attempt at correcting an imbalance. Like you might as well say, is it one system in the body trying to compensate for an abnormality in another system? So we can always investigate this by just looking at the opposing component of the problem. Again, we can always investigate this by looking at the opposing component of the problem. So how are you going to do that? For example, in an acidosis, we look at the level of bicarb. Whereas in alkalosis, to determine if the body is compensating, we'd look at what the PaCO2 is doing. Okay? So if the other level or component is within the normal ranges, then the problem is non-compensated or uncompensated. So ultimately, the body is yet to fix the problem or has been unable to fix the problem. That is basically what it means. However, if the other component has gone outside its normal reference ranges, then we can think of, oh, it is as compensation occurring. It might be compensation is occurring, or the body is trying to fix the problem. So better understand, to assess how well it has been able to do this, it is very, very important that we need to refer back to the pH. Again, if the pH is not within or close to the normal ranges, then a partial compensation exists. On the other hand, if the pH is back within the normal ranges, then a full compensation probably has occurred. Okay, now a non-compensated or uncompensated abnormality usually represents an acute change occurring in the body. Again, any uncompensated abnormality usually represents an acute change occurring in the body. And take note, the term partial or fully compensated usually is used to describe the level of compensation. But it does not necessarily mean that the patient ABG result is normal and that the patient himself is healthy. Think about that. Again, this is your nurse Edwin. Thank you and have a good day.